Salam sejahtera and greeting to Associate Professor Dr. Wan Amir. We're a student from Group 1 and going to present on the topic of the nerve gases, the devastating finding in the first place. Why should it be banned? This slide shows all the group members in our group. This is the table of content in these presentations. I'm Karen Ku Zihui. Now I'm going to present the introductions. Nerve gases are also known as nerve agents. They are a type of organic chemicals that interferes the mechanism by disrupting the transmissions of nerve impulses to various organs in the body. The disruption is caused by the blocking of the acetylcholinesterase, an enzyme that is responsible to terminate nerve impulse transmissions at the cholinergic synapses by rapidly hydrolyzing the acetylcholine that is released at the nerve synapses. As a result, excess acetylcholine accumulates at the parasympathetic sites. The interruptions of nerve gases in cholinergic synaptic transmissions could give rise to the muscarinic and nicotinic effects. Examples of the muscarinic effects are the emptying of bowels and bladders, blurring visions, and excessive sweating, while the example of nicotinic effects includes the skeletal muscle twitching, cramping, and weakness. Besides, nicotinic effects can obscure certain muscarinic effects and cause a rapid heart rate and high blood pressures. Nerve gases are extremely poisonous and can be synthesized and spread easily. They produce rapid physiological effects when absorbed through skin or through respiratory tracts. However, they were examined for use in the military due to their toxicity. Now, I would like to pass the introduction sessions to Nur Atika to present on the discovery on nerve gases.
Hi, I am Atika. I will continue this presentation with the second part of the introductions. For your information, nerve gases was discovered a few decades ago and can be grouped into two main classes, which is G series and V series. The first nerve gases, G series, was discovered by accident on 1936 by a research team led by Gerhard Schrader, a chemist of IG Verbens, while working toward his goal to construct a cheaper and better insecticide. Schrader was called the father of nerve agent because he involved in the discovery of all G-series nerve agent members like Tabun, Sarin, Soman and Cyclosarin. Apart from that, the second series of nerve agent was found on 1952 by two chemists Ranajit Ghosh and J.F. Newman, while they studied about organophosphates, ester as peptides. It also consists of 4 different members, and each properties of this nerve agent will be further explained by Evans. Moving on to the discovery and use of G-series nerve agent, Tabun was discovered when the vapor of preparation 991 caused toxicity to animals and humans. Schrader recognized this solution's potential as a chemical weapon and thus reported his finding to the Ministry of War. CDC stated that Tabun was used in Iran-Iraq War. Second potent organophosphate nerve agent, Sarin, was discovered in 1938. It was named after its 4 discoverers and widely used in ammunition in war. One of the common use of Sarin was in post-World War II by the Japanese New Religious Movement, Aum Shinrikyo, carried out by a group of 10 men led by Shoko Asahara. This attack was killing 12 people and causing injuries as well as symptoms of lung deficiency in thousands more people who were exposed to the gases. Next, Soman or GD was discovered in spring 1944, followed by cyclosarin, GF in 1949. According to UN Resolution 687, GS was classified as a deadly weapon in the world. Therefore, its production and stockpiling were prohibited. Lastly, VS is one of the best-known V nerve agents. It was discovered at Portadown in England based on Schrader's research. It is now a common V nerve agent that has been used as a chemical weapon in several deadly wars. On 2017, Kim Jong-nam, the half-brother of North Korea's leader, was found dead after being exposed to these gases at KLIA in Malaysia.
Good day, I'm Yvonne Gui. Today I will share about types of nerve gases. Nerve gases are a class of organic chemicals that can disrupt mechanisms by which nerves transfer messages to organs. It can also cause severe effect on the human body, such as coma, nausea, gastrointestinal pain, convulsions, contraction of pupils, and so on. Nerve agents can also be classified as persistent and non-persistent based on their volatility. Nerve gases are classified into G series and V series. G series is discovered in Germany in the 1930s and 1940s. It is synthesized prior to World War II. V series is discovered in 1952 by accident while scientists aimed to desynthesize insecticides and pesticides. Are extremely toxic volatile liquids, classified as outlawed. G-series nerve gases are also known as non-persistent, as well as they do not remain active in the dispersal area for very long and evaporate shortly after release. G-series nerve gases include Tabun GA, Sarin GB, Soman GD, and Cyclosarin GF. All the G-series nerve gases are clear and colorless liquid at room temperature. It is also odorless and tasteless. The lethality can be determined by potency when airborne and skin contact. Shows the smell and appearance of G-series and the year of its synthesis and the lethality. Move on to V-series. VG was sold as an insecticide under the name Amiton from 1954. The V-series contains 4 well-known members, which are VX, VE, VG, and VM. VX is the most toxic nerve agent ever synthesized. With a median lethal dose of just 10 mg, V-series nerve agents are highly viscous and have low volatility. VX has the lowest volatility, so they are difficult to wash away as they can persist in the environment. Unlike G-series, they are oily liquids at room temperature. The primary method of exposure is often through skin contact rather than inhalation because VX is around 2,000 times less volatile than Sarin.
Hi, I am Ahmad Firdaus. Now let's take a look at the toxicokinetics of the nerve gas. Toxicokinetics basically discusses on the routes of exposure and how it is absorbed into the bloodstream, how it is distributed throughout the body, the metabolism as well as the elimination of the substance from the body. Firstly, an individual can be exposed to the nerve gas through the inhalation of vapor nerve gas into respiratory tract, which will further be absorbed into the bloodstream via the alveolar capillaries. Next, a skin contact with liquid nerve gas can allow the absorption of this substance into the epithelial cells of the skin and then will gain access to the blood vessels in the dermis layer of the skin. Next, the nerve gas can also penetrate the eyes and eventually reach the blood vessels embedded in the sclera of the eyes. Furthermore, the gaseous nerve gas will be dissolved in the blood due to its high solubility in aqueous environments and will be transported in the blood to the heart. Eventually, it will get pumped throughout other parts of the body. As the nerve gas reaches the cells, it will be metabolized by undergoing hydrolysis mediated by A-esterases enzyme and will be further degraded as shown in this figure, which results in the formation of methylphosphonic acid MPA as the end product of the metabolic pathway. Last but not least, the major route of elimination of nerve agents is the kidney, in which it will undergo renal excretion and will be excreted in the urine. That's all from me. Now I pass to the next presenter.
Assalamualaikum and hi, my name is Aina Akilah and I will continue the presentation with toxicodynamic. Toxicodynamic is defined as the dynamic interactions of a toxicant with a biological target and its biological effects. Binding proteins, ion channels and receptors are the examples of biological target, also known as the site of action. Normally, a neurotransmitter known as acetylcholine is released when the functioning nerve is stimulated to transmit the impulse either to muscle or organ. Then the enzyme known as acetylcholinesterase will immediately breaks down the acetylcholine, preventing overstimulation and allowing the muscle or organ to relax, such as shown in the figure above. However, nerve agents cause their toxic effects by interfering with the proper operation of the enzyme. Nerve agents disrupt the nervous system by forming a covalent bond with the active site of the enzyme acetylcholinesterase, which mainly responsible for the breakdown of acetylcholine. Therefore, acetylcholinesterase was phosphorylated, resulting in the enzyme's inactivation, leading to the excess of acetylcholine in the neuromuscular junction. Hence, the post-synaptic neurons depolarized constantly, resulting in the cholinergic and muscarinic toxicity symptoms such as cramps and increased salivation. In addition, the bond between the nerve agent and the enzyme is permanent unless antidotes are administered. Until new acetylcholinesterase is synthesized, acetylcholine will remain in the neuromuscular junction, causing the constant depolarization, and cholinergic access symptoms started to arise. Besides, an enzyme such as pyridoxine can be used to regenerate acetylcholinesterase rapidly. On the other hand, initial phosphorylation may cause conformational change known as aging. Thus, acetylcholinesterase cannot be reactivated. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Sakinah Hayani binti Ibrahim. I will continue this presentation by explaining the biological effects of nerve agents on human. Exposure to nerve agents causes various symptoms. First of all, let's look at the symptoms based on the amount of exposure to nerve agents. It can be divided into two parts. Firstly, acute low-dose nerve agent exposure symptoms include a runny nose, excessive salivation and sweating, headache and nausea. Secondly, acute high-dose nerve agent exposure symptoms include difficulty in breathing and coughing, seizures and paralysis. Next, the effects of weapon nerve agent. The weapon nerve agents act immediately. Inhaling nerve agent vapor induces respiratory tract effects within seconds to minutes. The symptoms include excessive rhinorrhea and bronchial secretions, chest tightness and difficulty in breathing. Now, let's move to the effects of liquid nerve agent. Liquid nerve agents have a slower onset of action. Following cutaneous exposure, the symptoms include sweating and muscular twitching. For local gastrointestinal effects, the initial symptoms include abdominal cramps, nausea, and vomiting. Not only that, nerve agent exposure can also affect the central nervous system. The symptoms are tension, anxiety, restlessness, insomnia, slurred speech, memory loss, and depression. Now, let me share about the treatment of nerve agent exposure. The most important first step is to decontaminate the patient. This is normally done by removing contaminated clothing, thoroughly washing body and hair with soap and water, and flushing eyes with a large amount of water or saline solution. Contaminated clothing should be double bagged after removal to prevent further exposure. Next, nerve agent poisoning can be treated with the antidotes such as atropine and pyridoxine chloride. Atropine is an anticholinergic drug. Atropine acts by blocking all the muscarinic receptors of acetylcholine in the body and antagonizing the effect of acetylcholine. On the other hand, pyridoxine chloride acts by reversing the agent's mechanism of action and reactivating acetylcholinesterase. The irreversible nerve damage related to exposure can be avoided by early therapy with pyridoxine. That's all from me. I will pass this presentation to the next presenter.
We will now talk about the detection of gaseous nerve agents. The first part of detecting nerve agents is done outside of the body. So this can be done by doing ion mobility spectrometry. Ion mobility spectrometry, or IMS, separates ionized molecules of gas based on their mobility in a carrier buffer. When charged ions and molecules collide with one another, they will produce a readable potential or an electrical current. The peak values of this current will be rad and it will be related to the concentration of the nerve gas. The second way of detecting nerve gases outside of the body would be by conducting infrared spectroscopy. So infrared spectroscopy measures infrared radiation through the means of reflection, emission or absorption. Phosphorus, which makes up nerve gases, is very sensitive to electromagnetic radiation, and this allows the electromagnetic radiation spectrum to pick up on nerve gases and helps identify them efficiently. Another way of detecting nerve gases would be when they are inside of the patient's body. So a serum cholinesterase test can be conducted and it detects for the levels of acetylcholinesterase and pseudocholinesterase in the patient's bloodstream. Organophosphates, which are part of the nerve gases chemical structure, will actually go and damage the nerves of the patient, and it will inhibit the production of cholinesterase enzyme as explained in the slides earlier. So this causes the levels of serum cholinesterase enzyme to reduce, and this will indicate nerve gas toxicity in the diagnosis. Now let's get to the conclusion part of this presentation. To sum up this presentation, we have learned about nerve gases in detail. Nerve gases are acetylcholinesterase inhibitors, which can be divided into the V series and G series, and it can further be classified based on how volatile they are. Nerve gases will inhibit the action of acetylcholinesterase enzyme, causing acetylcholine to accumulate in the body, leading to cholinergic and muscarinic toxicity. In low doses, nerve gases are able to cause muscle abnormalities, whereas in higher doses, they are even able to cause paralysis, seizures, or even death. Thus, it is important to deal with nerve gas poisoning immediately by decontaminating the patient and by providing atropine and pyridoxine chloride administration to reactivate back the action of acetylcholinesterase enzyme. That's all from us. Thank you.